Microscopic Urinalysis Part 2 lecture. Casts are from the distal convoluted tubules and the collecting tubules of the nephron. They consist of the TAMS horsefall protein, and they are the only formed element that is unique to the kidney. They usually have a cylinder type shape to them. There are 4 factors that are included in the formation of casts. Proteins aggregate into individual protein fibrils that attach to the renal tubule cells. Then the protein fibrils interweave, forming a loose network that then becomes a solid structure that lines the collecting tubule. And then there are different urinary components as they pass by these structures, such as red blood cells or epithelial cells, that will then attach to the solid structure. And then the protein structure then detaches from the epithelial cell lining of the renal tubules and then is excreted as a cast. Casts can either be straight in nature or they can be curved, and when we get curved casts, that means that they formed along a curvature in the distal convoluted tubule or the collecting duct. Typically your distal convoluted tubule will have much more curves as it is curving around the glomerulus. Cast identification: we identify casts by the appearance. Casts are very translucent, so it is important to have low light in the microscope. Typical shapes are cylinder, parallel, margins, and then the ends are usually rounded. They may be convoluted or curved and may contain other elements, which we will talk about in a few slides. The edges of the cover slip are usually where casts can be found when doing the microscopic examination, and we usually look for these and count them on low power field, meaning 10x, and then we use a high power field to identify the type of cast, which is 40x. Classifications of casts: they are classified microscopically based on composition of matrix and the type of substance or cells enmeshed in them. So homogeneous, meaning that it looks the same throughout, is our Hyaline and our Waxy casts. Sometimes we'll have casts with cellular inclusions, such as red blood cells, white blood cells, renal tubule epithelials, mixed cells, or bacteria. Other inclusions can include granular fat globulins from cholesterol or triglycerides, and hemosiderin, which is an iron storage complex, can also be included in the casts. We sometimes will see a few crystals in the casts, however this is not common. And then pigmented: they can be pigmented because of bilirubin, hemoglobin, or myoglobin that could be present, and the size is typically quite large and broad. So hyaline cast, which is the only cast that can be considered normal in its presence. Clinical significance: less than 1 to 5 on low power field is considered normal. Increased numbers could be an indication of renal disease. However, some things that can also increase hyaline casts are strenuous exercise, so those who run marathons, dehydration, heat exposure, and also emotional stress can increase the amount of hyaline casts seen. The hyaline casts are made of TAMS horsefall proteins. They are colorless, semi-transparent, and they can be very easy to miss. So in this slide you can see the structure here very vaguely. This would be a hyaline cast, and as you can see, very easy to miss. And then there's a structure in here. You can kind of see the outline a little bit better on this one because the light is turned way down, where the light is a little bit more on the left-hand side of the picture. So the right-hand side, you turn the light down, you can see it a little bit better. Here's another picture of the hyaline cast right here in the middle, and then we got red blood cell casts, which the clinical significance, these are abnormal when we see red blood cell casts. Indicate serious renal conditions such as acute glomerular nephritis. And red blood cells can leak through the renal tubules or the glomerulus. With red blood cell casts, they can be colors yellow to orange to red to yellowish color. There can be hemoglobin casts which do not have defined circular shapes of the red blood cells, and this happens when the red blood cells then break down because of their age, but are they in the same color. So here's an example of a red blood cell cast. You can see a little bit reddish tinge in color, and then all the circular elements, the concaveness of some of the cells within this cast. Here's another picture of a red blood cell cast, and here's another one with a red blood cell cast. This one has a little bit less cellular circular components to it, but you can see the red in color and then a few red blood cells intact. White blood cell casts, clinical significance indicates that the white blood cells originated in the urine. Significance and findings means that there's probably polynephritis, and it helps differentiate our upper urinary tract infections from our lower urinary tract infections. An upper urinary tract infection meaning the kidney, and you would see the white blood cell casts. And the lower urinary tract infections, which would be the bladder, where you would not see as many casts in this type of condition. So here's an example of a cast. You will always see the outer border and then clumps of white blood cells in the middle. So it's important to distinguish that outer border so you can call it a cast. Otherwise, a lot of times in highly infectious urine samples, you will see clumps of white blood cells, and those would just be counted as individual white blood cells unless you've seen the actual border, then you would then call that a cast. So here's another example, and you can see this one has a little bit of stain to it, so it dyes the white blood cells quite nicely and highlights them. And here's another one in this picture. Granular cast, the clinical significance, the granules seen in a granular cast results from the breakdown of cells within the cast. There can be coarsely granular or fine granular. There's really not a huge difference between the two, and you won't need to differentiate between the two. And these types of casts result from stress, strenuous exercise, or nephrotic syndrome, and oftentimes congestive heart failure patients. So here's a picture of a granular cast. See all those little granules in there. Another picture of some granules. And this one is a fine granule, and this is what we would consider a coarse granule cast. Waxy casts, oftentimes called broad casts, and they can also be called renal failure casts. Clinical significance, similar to hyaline, but they have a yellow appearance, more refractive, sharper outlines, and it simply implies that there is end-stage renal disease or chronic renal failure going on. And waxy casts refer to the size and the shape of the cast. They are very broad and have a large diameter. More serious condition, and the other name for it is a broad cast. So here is an example of a broadcast, very cylinder-like, very sharp edges, as you can see here. Here's another one. And sometimes they will have cracks or slits in them too, but they have very blunt ends. Bacteria, clinical significance. Under normal conditions, urine is free from bacteria. Sometimes there can be a few bacteria present because of the collection technique if there was contamination. A lower urinary tract infection has bacteria but with few white blood cells. An upper urinary tract infection has bacteria with many white blood cells. So here's a picture of bacteria. It's all these little dots and slits among the slide. This person is flooded with bacteria. Yeast. The clinical significance, more frequently seen in females due to the moisture in the genital area, and in diabetics due to the sugars present. The yeast feed off of that. So here's a picture of yeast, and they look like red blood cells. They're a little bit smaller, however they are not concave. And you will always see yeast, and this yeast has a little bud here. We call this budding. And sometimes you will see bacteria also present. So here's another example of yeast. You can see they like to form chains and clusters, and that's a way to identify whether they're yeast or red blood cells. And this one also has a hyphae growing off of it. Sperm, the clinical significance, it may be present in both male and female, and you should record this according to your lab protocol. And then there can also be artifacts within our slides, and a lot of times what shows up is hairs, which can look somewhat like this. You can have artifacts that don't look like much of anything. You can have, here looks like a hair of some sort. And then you can also have air bubbles that can form, hair, diaper fibers sometimes in children, you can see. So there are a lot of different artifacts that can show up, and we don't need to report those, but we need to look beyond them. Microscopic techniques, so examine within 2 hours of collection. There should be correlation of the physical and chemical results. It's important to do the physical examination first and then the chemical results. We cannot do a chemical exam after the microscopic portion has been done. What we would do first, after the physical and chemical results are done, we would scan on low power using 10x and report the low power field for squamous epithelial cells and cast cells. Those are the only two that are reported on low power field. And then we would go to our second step, which would be scanning on high power field, meaning 40x, and report all the other components as indicated. Here's what we would report. So normal sediment, little or no sediment. Red blood cells, the normal range is 0 to 2 per high power field. White blood cells is 0 to 5 per high power field. Hyaline casts are 0 to 2 per low power field. Renal epithelials are 0 to 2 per high power field. Transitional epithelial cells are 0 to 2 per high power field. Squamous epithelial cells are few for low power field. Bacteria should be negative, but you can have a few per high power field. And then abnormal crystals, there should be none per high power field. Sometimes you will have normal crystals that are present if urine has sat out too long.